On today's show, listen and learn from expert insights on everything ranging from
clinical and translational science,
health disparities,
genomic studies,
inclusion,
collaboration and partnership,
team science,
patient advocates,
basic science,
and much more from the Association for Clinical and Translational Science National Conference in our nation's capital. We're taking our show on the road, and you're coming with us inside this special edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. Recently, CTSI Discovery Radio traveled to the Association for Clinical and Translational Sciences National Conference at the Washington Hilton in Washington, D.C., to gain expert insights from several speakers and presenters at this annual meeting. And since you couldn't travel with us, we're taking you with us virtually. Our first conversation is with Dr. Alan Brazier, President of the Board of Directors for the Association for Clinical and Translational Science, or ACTS, who tells us,
by using the word translation, we mean advancing health interventions from the bench to the bedside to sustainable use in the community. The process of translating discoveries into health is inefficient, expensive, and complicated. So ACTS is an organization of translational scientists united to accelerate advances in human health.
ACTS was founded to support federally funded translational science institutes, including the CTSI.
With the conception of the Clinical and Translational Science Awards, there was a need to create a scientific community for this new type of science. ACTS was founded in 2009 under the name of Society of Clinical and Translational Science, and in 2013 it became ACTS through the merger of the society and 2 other similar organizations.
Simply put, ACTS was started because
we needed a professional organization that would support the growth of this new discipline of translational science.
With this stated mission,
ACTS is committed to advancing the discipline of clinical and translational science to improve human health.
It does so with a dynamic, diverse team
composed of major academic medical centers leading translational research across the United States. ACTS strives to create an inclusive leadership from all of these in order to represent the variety within our membership, guided by an elected board of directors composed of 17 individuals from these member institutions. These members support research programs in broad areas from epidemiology to team science, neurology, biostatistics, data science to community engagement.
Next, Dr. Brazier tells us the ACTS focuses on 4 key areas, including research.
ACTS supports cross-cutting research that encompasses multidisciplinary investigative teams from many different subspecialty areas. To advance this, ACTS supports 10 special interest groups, or SIGs, communities of translational scientists from our member institutions that collaborate and share resources. Some of our SIGs include the team science professionals, evaluation, informatics, and biostatistics, epidemiology, and research design SIGs.
Advocacy.
ACTS advocates at the local, state, and federal levels for more funding and to affect public policy. In addition to our advocacy committee, ACTS collaborates with the Clinical Research Forum through the Coalition of Clinical and Translational Science. Through this, we maintain a presence on the Hill where our scientists meet with our congressional representatives to communicate the impact of the local health and economic benefit for continued support for the CTSA.
Mentoring.
ACTS provides a forum for advancing mentorship for leaders to share stories, promote best practices, and optimize professional relationships among trainees and mentors. Our special interest groups also serve as a place for mentoring, where an open dialogue is fostered and participation is open to all ACTS members. Here, junior investigators have access to other more senior investigators and have the opportunity to learn and collaborate on common projects.
And education.
Our annual meeting is the place for trainees, where trainees, junior faculty, and senior scientists meet to learn how to design and conduct clinical and translational research. Within this meeting, we provide mentoring sessions, mock study sections, the process by which grants are reviewed, communication practices, and other skill-building activities.
And that's exactly where we are today, at the ACTS Translational Science, or TS 2025 meeting.
The theme of the Translational Science 2025 is focused on using data science to accelerate translation. I think we all understand that artificial intelligence provide transformative impact on how we do things, how we do research, and it has large impact on translational science.
As such, the design of TS 2025 is
to provide network opportunities with attendees that span these career cycles. So using data integration from public repositories of health information, applying artificial intelligence and computational methods, all will improve the efficiency of translational research and make our research better and more generalizable.
in addition to some of the specific learning sessions we'll hear about shortly. TS 2025
Includes a robust poster hall. Poster presenters get expert feedback on their work and they form new collaborations. We also offer speed mentoring, mock study sections, advocacy training, and the Hill visits, which we talked about earlier, as well as the 3-minute thesis competition where junior investigators learn how to communicate their science in ways that are understandable by the general audience.
And by experiencing TS 2025,
We hope that attendees specifically will gain knowledge of data science and use these to broaden their research approaches and make lasting connections and collaborations.
Dr. Brazier was selected as president of the ACTS Board of Directors just last year.
This last year has been a very exciting period of growth for our association in many ways. Translating health interventions from the bench to the bedside to the curbside includes a number of different skills beyond the reach of any individual. Effective translation then depends on effective teamwork. To advance this, many institutions support the processes of team science. ACTS has added new programming for the growth of team science professionals.
Plus, he highlights other critical areas of continued growth.
Our bioinformatics and biostatistics special interest groups have also worked together to create an integrated approach for these fields to better utilize data science and translation. This promises to be transformative by allowing more efficient use of centralized and connected repositories and increasingly complex data, standardizing data exchange, and enhancing its accessibility. The ACTS special interest groups are working to establish frameworks for evaluating when and if data science and artificial intelligence are fit for their purposes.
Alongside his role with ACTS, Dr. Brazier is also a clinical physician and research scientist at the University of Wisconsin School of Medicine and Public Health.
I was attracted to coming to UW-Madison because of the opportunity to expand our truly interdisciplinary team science program that we developed at my prior institution. UW-Madison has unique opportunities in integrating interdisciplinary approaches through medicine, pharmacology, engineering, nursing, and veterinary health to accelerate translation.
Dr. Brazier is also executive director of UW's Institute for Clinical and Translational Research, or ICTR.
We call it ICTR. So ICTR is a cross-campus institute that involves 6 different schools, which embrace our interdisciplinary nature. ICTR brings its innovation of team science, mentorship, dissemination and implementation, and learning health system to these component entities.
And ICTR partners with others, like Marshfield Clinic and Research Institute, to impact the health of both urban and rural communities in Wisconsin. For example,
we use neighborhood health reports for communities to understand the health of their constituents for research planning. We've enabled eye screening interventions across the state to enhance the detection of diabetic eye disease and to reduce the impact of blindness. We've supported the dissemination of a rural first responders training program to reduce injuries in high-risk profession In addition, we're deeply involved with our learning health system in partnership with UW Health, being able to evaluate and use artificial intelligence in ways that is both ethical and impactful.
So, what's next for ACTS beyond TS 2025?
ACTS leadership will be creating our next 2026 to 2028 strategic plan in the coming months. For the remainder of this year, we will continue to focus on supporting our committees and our special interest groups. And we are also continuing to develop career pathways, which are important for our field.
Dr. Brasher is also excited to share that
TS 2026 will be in Milwaukee, and we anticipate having a very robust attendance there.
But right now, it's time to go check out TS 2025.
TS25 is to advance this process of translation that ultimately will result in improved health and to be able to take the science and make it locally impactful to improve the health of everyone in the country. So there's no other meeting quite like it.
We take the elevator down to the concourse level of the convention center, where we first connect with Dr. Kat Phelps, community-engaged research consultant at the University of Wisconsin School of Nursing, who is on her way to co-facilitate a discussion on community leadership.
There's a growing intersection of academic and community voices coming together to making stronger research that has a broader reach and greater relevance, because all the way through the cycle, the community member has been involved in the process. Not at the end when it's all said and done, but all the way through the process.
And she tells us why collaboration between the medical research enterprise and the community is so vital for successful translational research.
One of the areas that translational research has really been focused on and trying to improve is health disparities and changing some of the inequities that exist.
Because in order for research solutions to most effectively serve communities,
they need to be coming from and working with communities. So we know that there's marginalized populations that are underrepresented in academics, and some of those same groups are ones that have health disparities. So I think the only way to successfully move the needle on health disparities is involving the people that are most impacted by them.
Which has led to the emergence of community-driven research approaches, with academic medicine sometimes stepping aside.
We prioritize a certain kind of knowledge. And what happens is that we sometimes put that above the knowledge that comes from living in the world and lived experience. And what we want to do is elevate lived experience to the same level as this academic knowledge so that together they can create the new innovation.
So, an important element of success is mutual responsibility and realizing
it can be fluid, it can be shared, an awareness that there can be really exciting, innovative partnerships that share power, but the idea that person power, brain power, innovation is available on all sides, in all ways, is a really exciting, I think, and important vision.
Next up, a conversation with Dr. Carmen Buxo, a genetic epidemiologist at the University of Puerto Rico Medical Sciences campus, who just co-led a session on community leadership in genomic research.
It was a wonderful experience leading this panel of experts. And the session, we emphasized making diverse voices heard, not only participating in the study, from the beginning of the study. So it is important to engage with the communities before conducting genomic studies.
It's important to engage early in the process because
there's some mistrust built through the years about genetics. What stood out most from the session was the commitment to ethical, respectful, meaningful engagement. And it's all about trust, reciprocity, and leadership between the gatekeepers of the communities and communicating with investigators. We have to come to them and be part of their communities.
She was joined on the expert panel by her cohort, Dr. Elinette Albino, an associate professor and clinical genetics researcher, also at the University of Puerto Rico Medical Sciences campus.
While we have seen progress, engagement remains uneven and insufficient. Many minority and vulnerable populations are still underrepresented in genomic studies.
Although this has improved somewhat in recent years.
A decade or two ago, inclusion was largely an afterthought. Today, there's a growing recognition, thanks to community advocacy efforts and also LC research, that equitable participation is essential. But there's still a long way to go, bringing the community to our research.
Dr. Buxo adds, increasing the engagement level of minority and vulnerable populations in genomics research is
Absolutely critical. We need to include literacy, for example, and overpass language barriers, cultural background, or the context of the target population that we want to study. There's also medical distrust that comes from previous studies or clinical trials, and in genomic research is very important for them. They're giving their genetic information, so they want to establish a trust between the researcher and these communities so they can engage in genomic research.
Final thoughts.
Diversity in genomic research is not just a goal, it's responsibility.
There have been improvement. I cannot say that there hasn't. But it's not only publishing your findings in medical journals, it's also being empowered with those findings to do something in their communities.
On to a conversation with Dr. Lynette Hammond Gerardo, Assistant Professor, Department of Bioethics in the School of Medicine at Case Western Reserve University, who co-led a discussion on the prioritization of funding for health equity research through collaboration between the academic and general communities.
I thought the session went really well. The idea of our CTSC being a funder of these types of grants that prioritize collaboration and partnership with community organizations, and then also the perspectives of researchers, giving examples from our projects that actually did that. And then having this dialogue around how that can be a challenge. And so I think that was really helpful because it went beyond the funding, but also spoke to some of the things that you're doing to cultivate and sustain relationships.
Unfortunately, over $179 billion invested in health equity over the past 20 years has yielded only modest return on investment. Why is that?
If we're looking dollar for dollar, that's going to be interesting. And I think that some of the challenges that relate to equity are hundreds of years old. So I think it may just be a slow-moving glacier that has to be chipped away at over time.
Whereas metrics other than dollar for dollar might show better marks of success.
Like how many people have been made aware of clinical trials, how much more accrual have we gotten in our trials, how much more representative are our trials, how many more people are aware of the ethical considerations that we put into our research, and then amazing new ways that people can be engaged in research.
And so, all that's to say,
research takes time, and so bringing in community partners at the outset and designing a study, then to actually implementing that study, then finding results. I'm not saying that it has to be linear in that way, but as long as we're creating this pipeline, I think that we're headed in the right direction.
Next, Dr. Gerardo tells us about a pilot study by the Case Western Reserve University's Clinical and Translational Science Collaborative to increase diversity in clinical trials by eliminating participation barriers through community engagement.
Sometimes there's assumptions made about whether or not people will participate. And yes, there's been a lot of discussions about mistrust, but sometimes people simply aren't offered the clinical trial. Then how do you know what's available?
Or another common barrier,
sometimes the eligibility criteria for trials can be very rigid. Moving forward, relax some of those so that we can have more people included.
But with researchers and communities working together,
communities have something to contribute to those conversations, as well as researchers have a lot to learn. But when funding is available and structured in a way conducive for academics and community partners to come together, it can have a positive outcome.
Day 2 of our visit to TS 2025 begins with Dr. Stacy Farr, Associate Professor at the University of Missouri, Kansas City, who is heading to co-lead a discussion on transforming healthcare by addressing a well-known gap in
How we get evidence generated either from clinical trials or research studies or whatever it may be being taken up in clinical practice or in communities to really improve population health outcomes. Our angle is really trying to find a common framework to more rapidly get evidence taken up into clinical practice and to really kind of speak a common language.
Why is the need to narrow the gap so critical?
It's critical because it doesn't allow us to innovate more quickly. And so if we can find ways to actually address that challenge, it's the most important thing. We haven't been able to crack that nut yet, so we really want to.
So she's working on it through something she helped develop called the Training in Implementation Actionable Research Approaches, or TIARA program.
It's the middle ground of quality improvement, which has its own methods with kind of ivory tower academic implementation science. And we're really the middle. It's really kind of taking the best of both worlds and doing implementation practice so that we can be very real world about how we can use best practices from academia, but do it in a more rapid way and get evidence taken up a lot faster.
And there are measurable results that show the TIARA program is working.
We have been tracking a number of metrics. One is based on some validated metrics of quality improvement knowledge and implementation knowledge. We do a pre-post analysis of understanding if we're improving that kind of knowledge and gap for everyone over time. What we're also doing is starting to track over time what this has led to. Did it lead to a clinical change in care or other collaborations across those disciplines? But yeah, we're seeing really great signs in a number of metrics.
Also critical to the success of the TIARA program, team science.
Team science, I think, is embedded within the TIARA program. Team science is critical because if you want to make a change in healthcare or in a community setting, you clearly need to utilize those principles so that you can be most efficacious in what you're trying to accomplish.
If you want to learn more,
visit our website, healthcare.umkc.edu,
and discover how TIARA is transforming research.
We all know making change in anything is hard. Change is hard. These are big changes and we want to make big impacts, and it's ultimately for the end user so that we can improve patient outcomes, so that we can make population health better and we can be better delivering quality and value-based healthcare for everyone. But what TIARA really does is address a need that there's a hunger for. Speak a common language and do the work we want to do smarter and not harder.
Up next, a conversation with Dr. Barbara Segarra, Professor and Dean of the School of Health Professions at the University of Puerto Rico, following her co-leading of a session on the crucial role of patient advocates in research.
I think it was a great session. I had 2 other colleagues participating with me, a patient living with metastatic cancer and a researcher who has worked with patient advocates. So sharing our stories gave the aspect to the audience to understand how they can really involve patients and what they're doing in research.
What exactly is a patient advocate?
The patient advocate is that voice of a patient that can be translated to researchers, policies, and other areas. Anyone can be a patient advocate, right? And I think the most important thing to understand is, first of all, you should advocate for yourself to understand what is happening to you, what is more convenient to you, and what are you willing to risk or not when they offer you a treatment. So that's where it usually starts.
And who better to advocate for others than someone who advocates for themselves?
After you have advocated for yourself, many of us want to do more, so we start doing more.
For example, becoming a research patient advocate.
Being involved in the research, right? Many of us are alive because of the research. I'm a breast cancer survivor twice. So we want to be involved in helping the researchers come up with ideas, what will work.
Dr. Segarra underscores the importance of advocates in research, adding that
we can bring that sense of urgency to the researcher, but also the importance of listening to each other and learning from each other, right? As advocates, we learn from the scientists, but other times the scientists said, that's a good idea. We never thought about that. So it's that mutual benefit that has an impact.
And the most essential way that the voice of patients and patient advocates can impact research is,
well, in every way. Patients should be participating in the whole cycle of the research to benefit the research and the outcome.
being a patient advocate has its challenges.
Not everybody is born to be an advocate. Some work, some don't. It takes time for the advocates to learn, and the challenge is to be first willing to participate.
But for those who are willing and able,
If you have an academic institution near you, give a call and say, do you have any activities for patients? Can I talk to a researcher? Do you have listening sessions?
the key is be intentional.
Yes, they won't bite.
One final conversation, this one with Taylor Brooks, a fourth-year PhD candidate at the Mayo Clinic Graduate School of Biomedical Sciences, just before she co-led a session on integrating community engagement in basic science.
When we're referring to basic science, we're really referring to research that explores the fundamentals of biology. So things like how cells function, how genes are regulated, or how proteins interact. These are all fundamental building blocks of biology that we need to do research and put things into the clinic.
Basic science research is not typically seen in public. It primarily takes place in the lab.
Using cell models or animal models to really delve deep and uncover mechanisms that really drive health and disease. But it's often a few steps removed from direct patient care or the community health. So it doesn't always have an immediate visible impact.
Don't let the term basic fool you. This is essential foundational science and research for all of us.
Just because it's happening on the bench doesn't mean it can't or shouldn't be informed by real-world experiences from patients, from the public, and that's exactly why community engagement has a role in basic science.
That said, the current level of community engagement in basic science research is very early stage.
Historically, most engagement efforts have always been focused on clinical trials or public health research, but in basic science, it's been a bit of an afterthought.
And although there's been improvement, there are still obstacles in integrating community engagement in basic science.
Many scientists aren't really trained on how to engage with the community.
Making the session she's co-leading at the conference a crucial conversation.
We can share strategies and begin really shifting the culture around that and begin teaching community engagement belongs in all steps of research. And here's some simple ways you can start. So I really think that's why these conversations are important.
Just as it's important to integrate the voice of the community into basic science research.
When we invite the community, even at the early stages of research, it can also help reshape the kinds of questions we're asking, the diseases we prioritize, or even how we interpret our own data. It also is a step towards repairing some of the historical mistrust we see with a lot of the marginalized communities that exist. Engagement really builds trust, and it reminds us that science really doesn't happen in a vacuum. It happens in service of the people.
And by being more intentional about incorporating community voices into research,
it really pushes us to think more holistically about biological problems that we're trying to solve. Intentional engagement also helps make our research more trustworthy, I think. It really ensures we're not just developing technologies that work in theory, but they actually reach the populations who need them the most.
Bottom line, the community voice. We are wheels up and heading back home for this edition of CTSI Discovery Radio. Thanks to all of our TS 2025 guests for appearing on today's show. Dr. Alan Brasher, Dr. Kat Phelps, Dr. Carmen Buxo, Dr. Elinette Albino, Dr. Lynette Hammond-Gerardo, Dr. Stacy Farr, Dr. Barbara Segarra, and Taylor Brooks. I hope you've discovered something by listening to today's show, and I'm doubly hopeful that you'll join us again next time. CTSI Discovery Radio airs the third Friday of every month. Make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Reza Shakir.